Hi everybody, I hope you are having a wonderful day. Today's video is going to be a review of the Biolase Epic H preset settings. So once I have turned my laser on and I've entered in my passcode, which is 888, we see a screen that offers us some hygiene procedure presets. The first preset that we will review is number 1, and it is labeled pocket therapy. Now, depending on who you've been trained by, pocket therapy is also known as laser decontamination or laser bacterial reduction. So with your pocket therapy setting, this is going to be your full mouth disinfection that a dental hygienist would perform in conjunction with their instrumentation. So the type of an appointment you would be seeing a patient for is generally going to be your prophylaxis, a perio maintenance, or even with your gingival scales. You will be selecting pocket therapy. Now the preset on my pocket therapy is going to be 0.5, and over here on the right hand side of my screen you can see where it says CP and followed by a 10. CP stands for comfort pulse. So when selecting a pulse mode, that's going to help with the comfortability of your patient. The preset for this particular mode on this laser is CP10. So what that indicates to the clinician is that the laser is on for 10% of the time when the laser energy is being emitted. Now, a shorter pulse mode, like having your laser at 10%, allows for the heat and the laser pulse to contact the tissue, and then that laser energy has a chance to dissipate and diffuse into the tissue before that next pulse is going to come through. So now if I go ahead and hit my home screen, and we can look down and see number 2 is labeled perio debridement. Now, perio debridement may also be a procedure known as laser assisted periotherapy. On our Epic H, we have the setting at 0.8 and your pulsing mode is 50%. So this is telling us that the laser is on and pulsing for 50% of the time that you are using the laser for your patient. So with this particular setting, perio debridement, this is going to be your post-scaling and root planing procedure. Perio debridement would be used with a non-initiated tip in a state where a hygienist is not allowed to do the procedure curettage. So when doing quad scaling non-surgical periotherapy and you're done with your quad scales, you're going to go ahead and select perio debridement for that post SRP procedure. Now if I go down to number 3, I have a procedure that is labeled curettage. And what you're going to notice with this is it is the same setting as perio debridement. It is set to 0.8 watts of power and the pulse mode is 50%. So what to keep in mind in the difference between perio debridement and curettage. Curettage is not allowed by the State Practice Act for every state that a dental hygienist is in. So when you do the procedure curettage, typically that is going to be done with an initiated tip, and the hygienist will de-epithelialize the patient's periodontal pocket. So the difference between our preset at number 2, perio debridement, and preset number 3 is if you are in a state where you can perform the procedure curettage, you will be using an initiated tip and selecting your preset number 3. Now, if I go back to our home screen, so the next preset on our Epic H is going to be number 4, which is labeled aphthous ulcer. You can see that the laser is set to 0.7 watts of power, continuous wave. Now, continuous wave means you will have a consistent, even distribution of laser energy as long as the laser is activated and firing. So you'll be getting a 0.7 watts of power. Now, if needed, you could come in here, hit continuous wave, and go to a pulse mode for patient comfort if needed during the procedure. But I find that with my high evacuation at a continuous wave, about 0.7 watts of power, it's very comfortable for the individual. So I never really find it necessary to go into a pulsing mode. But if needed for patient comfort, you can also select a pulse mode for this procedure. Now, if I go back again to the home screen and go down one more, I can see that number 5 is labeled herpetic lesion, and it's the same setting as aphthous ulcer. So whether it's an aphthous or a herpetic lesion, you can confidently choose one of those lesion presets to treat the lesion, as they are set to the same amount of power and the continuous wave mode. Now, if I come back to my home screen, we can see that we have one more preset to review, and this is hemostasis. Hemostasis is set to 0.5 watts of power. It's also continuous wave. Hemostasis would be a procedure that a hygienist would do maybe post-operatively after a scaling and root planing to help form the fibrin clot within the patient's sulcus. Also, it prevents and helps to stop bleeding. So if we have any areas that are still heavily bleeding following our scaling procedure, we can select hemostasis, and forming that fibrin clot within the periodontal pocket really helps promote the healing of the tissue. Now with our Epic H laser, it is a 980 wavelength, which is great for dental hygiene because that wavelength is going to penetrate a little bit deeper when we compare it to an 810 wavelength. So with our laser hygiene procedures, we want to affect the bacteria that embeds itself in the patient's sulcus. So thank you for watching our video today about the Epic H and reviewing the presets that a dental hygienist would use this laser for. Please like our video, please like our channel, and we hope to see you back soon.